the healthcare industry is still feeling immense effects from COVID-19, especially as we're talking today about a dwindling workforce, a changing workforce. According to the Texas Workforce Commission, 23,000 registered nursing positions are still unfulfilled, which means a lot of patients don't have the access to care. And so, Dan, can you set the stage for us a little bit and talk about the healthcare landscape before COVID and the changes you've seen over the past 3 years?
Sure. Thank you. Good afternoon, everyone. Before the pandemic, we saw travel nurses accept contract assignments to go see new cities, to build their resume, and for a sense of adventure. Through the pandemic, demand increased for staffing in every single healthcare facility, and travel nursing demand really skyrocketed. And we saw nurses leave staff positions to take travel assignments for the first time ever. And really the major motivator was money. And this was a new dynamic. I think it was very new for nurses to have to get out on the road, to live in a city that they weren't accustomed to get used to a new facility, especially a facility that was probably under a great deal of stress and pressure. Through that, burnout increased, nurse-to-patient ratios got stretched, and we saw clinicians completely leave bedside, which further made this problem even more acute. So, what's happening now? Well, as census has somewhat normalized and dropped, we've seen the demand for travel nursing also drop, and pay packages have declined. We're seeing nurses go back and accept staff jobs, or maybe reapproach their original facility. And I think that doesn't mean, though, that the staffing demands at these facilities have been met. And so we're seeing the facilities be really creative about trying new techniques to fill the shortages, creating internal resource pools. In acute care facilities, we're seeing facilities hire more LPNs to help out along the RNs. We're seeing more CNAs be hired. We're seeing virtual sitters and sitters to take the jobs of the CNAs to free them up. So there's a wide variety of techniques that I think we're seeing healthcare facilities do to continue to combat the staffing shortage.